I'm presenting DNA methylation as a potential mediator for environmental exposures on risk of childhood acute lymphoblastic leukemia. ALL is got a really high cure rate at the moment, but we still know very little about the actual causes. So we know there's an initial genetic abnormality, something else happens for ALL disease manifestation, and this is what I'm interested in. So there's a large amount of epidemiological studies that have looked at various environmental factors being associated with an increased risk of disease, but we're not actually sure how these environmental factors are affecting the risk. So that's where DNA methylation comes in. So I'm looking at DNA methylation mediating the effect of these environmental exposures on ALL risk. My paper and my presentation that I'm going to do, I'll concentrate on the in utero exposures. So this can be maternal smoking, maternal alcohol, folate intake, iron intake. There's even kind of small amounts of data looking at paint exposure, chemical exposures, pesticides, herbicides, but obviously the data supporting that's poor compared to the smoking and alcohol. Really important, yeah. During in utero development, there's a massive demethylation after gamete fertilisation, and then remethylation, and I think this is a really key part. So this remethylation stage during development is probably key, and maternal exposures kind of in this key stage of development for the fetus is probably a very, very important time. We know that DNA methylation can be altered by the environment, and we know that environment is associated with increased risk of leukemia, and we also know that there's altered DNA methylation in ALL. So it's kind of piecing this all together. So my hypothesis is that, say, alcohol or smoking or folate is altering methylation, either increase, decrease, and this is then potentially driving a secondary hit in leukemia. There's obviously DNA damage as well with stuff like smoking, but it's kind of the switching on and off of different genes that will then affect kind of the drive of leukemia. But still, at the moment, we're not really sure. I've kind of done more of a general, are these environmental factors able to alter methylation, and is this methylation also altered in leukemia? So at the moment I'm kind of piecing this story together, but I definitely need more work on exactly what the downstream effects are, and if in fact this is driving leukemia, not just kind of a byproduct. Smoking and alcohol definitely should be avoided. Folate's been shown protective in a number of studies, as well as being specifically protective for leukemia. Yeah, I think they're the main kind of messages at the moment, and it's definitely something that should kind of be made a public message. I don't think many pregnant women are necessarily aware of all the different exposures that could be affecting them. A lot of women don't really think about caffeine as well. Caffeine is another exposure that I've seen an association with an altered methylation, which has also been seen in ALL. So I think just getting the message out there that if your child has this initial genetic hit, and then you go on to drink large amounts of caffeine or smoke or drink alcohol, or all these different exposures that maybe I have not even looked at yet, this could then go on to develop leukemia in your child. And I think it's a message that definitely needs to kind of be spread. This is kind of, I've split my work into in utero and postnatal. So the postnatal it's kind of all in support of the delayed infection hypothesis. So the idea is that children who either attend daycare or childcare or nursery at a later age or fewer hours build a less mature and adaptive immune system. So then when later confronted with a common infection, their immune system is more likely to have a higher proliferation, and there's more chance of a mutation, which could be a secondary hit on the multiple hit pathway to leukemia. So again, and there's a lot of evidence to support this. My work can it can all come down to some really simple key messages for mothers, care prenatally, what you're putting in your body, how this could affect your child. And then the early years, because the peak incidence of ALL is between 2 to 4 years, so we know these first few years are really, really key. So yeah, I think it's about messages for the mothers and just making sure that your children are out there interacting with other people and building their immune system.